When we are in a stressed response state, that go, 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 the sympathetic nervous system, we are typically not taking deep breaths. Hi everyone, my name is Dr. Amanda Zariello from Restore Physical Therapy in Cranston, and today I'm going to talk to you about why your neck pain may not be a muscular issue but a breathing issue, and let me tell you why. Oftentimes people complain of a lot of tightness and neck pain coming from their shoulder all the way into their neck, sometimes even into the anterior part of their neck. They often complain of pain and weakness by the end of their day, feeling like they have to in a stressed response state, that go, 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 the sympathetic nervous system, we are typically not taking deep breaths. And what is happening is we are using these accessory muscles in our neck, our upper trap, our scalenes, to take short, shallow breaths when we're in a stress response state. And those muscles really shouldn't be activated unless you're sprinting. That's when those muscles are really activating. But when we're sitting at our desk, holding all that tension in our neck, the solution may not be to stretch your neck or to strengthen your neck, but to actually breathe differently. So I'm going to tell you 2 exercises today that is going to incorporate long, slow, diaphragmatic breathing, which automatically gets you into that rest and digest, that restful state where you can create expansion in your body, you can have more blood flow, more oxygen, and just generally less tension. So when you breathe, you automatically get into that restful state, and it's a tool you have access to 24/7, and you don't need any equipment for it, and it's really important to learn how to intentionally breathe diaphragmatically. So let's go into that first exercise. So here's your rib cage, okay? When you inhale through your nose, you want to think about your rib cage expanding up and out like a bucket handle. So place your hands on your ribs, inhale through your nose, think about the oxygen coming down, in through your chest, all the way into like your low back. You almost might even feel some tension or expansion in that middle to low back of your spine when you really inhale all the way down. And then when you exhale through pursed lips, the exhale is really where you should feel that relaxation piece. And you want your rib cages to come down and in. And if you notice, when you can breathe in through your rib cage, your shoulders will automatically settle down. They won't feel like they're at your ears. And you can just notice the feeling tone in your body when you take long and slow, deep diaphragmatic breaths. Inhale through your nose, filling the air all the way 360 into your ribs, and then exhaling almost to a count of 8 seconds. So that is the first way to practice long diaphragmatic breaths. And I'm going to show you another exercise that incorporates breathing that's going to really help lengthen the tension in your upper trap muscles. So I'm going to get on the table and do this. So you're going to lay on a flat surface with your knees bent. You're going to keep your hands by your side and your palms up, and again you're going to be breathing through your nose. You're going to inhale through your nose, and then on the exhale you're going to reach your palms down towards your feet. In through your nose, and reaching. And what you'll notice is that you're lengthening those shoulder muscles in your upper trap. So instead of them being by your ears, they're lowering down towards your feet. try those 2 exercises out to decrease the tension in your neck. And remember, if you are feeling like you're in a stressed out state and you're having neck pain, it might not be a muscular issue, it's a breathing issue. If you have any more questions, call us today. I'm Amanda Zariello from Restore Physical Therapy.